My name is Taryn McEvoy. I've been a physician here at Oakdale for 5 years, and I'm a working mom of 2. And I always tell people that being a working mom is the hardest thing I've ever done. I got through college and med school and residency without ever drinking coffee or caffeine, and now I need it to get through the day. So I've never realized how much work this would be, or how fun it would be. It's a really fun part of life, and I love my job and being a mom. Well, the first thing when I see a new couple who is, planning pregnancy is just to sit down and review their past medical history. To look at, do they have any medical problems? What medications are they taking? What is their lifestyle? What is their career? How are they living their lives? And then we want to optimize the medical conditions to get the woman and her partner in the most healthy possible place in life. So I think that's the first and foremost thing that we want to do. I think the first thing is getting on a prenatal vitamin at least 3 months prior to trying to attempt pregnancy, and that is going to get enough folic acid built up in the system to prevent neural tube defects in the baby. And so any prenatal vitamin that's available over the counter with 800 mcg micrograms of folic acid is what we want. And then adding on, especially once you get pregnant, a DHA supplement, about 200 milligrams a day. Also, trying to just, again, with optimizing the medical conditions, getting into really a normal weight range is going to decrease our risk of miscarriage and improve our chances of pregnancy, and then decrease complications of pregnancy and delivery. So trying to exercise, be in the best physical condition you can be prior to getting pregnant. In general, we want to feed our babies, inside us and outside of us, healthy foods. So I always talk to women about really looking at revamping the way we eat, the way we live, prior to bringing the baby into the world. And so getting rid of processed foods, eating out too much, trying to really eat whole, natural foods, getting rid of, diet sodas, diet really anything. And if we can get away from soda in general, I'm trying to be generally as healthy as we can be, and eating, normally, not starving ourselves and binging at the end of the day, but trying to live the way you're going to live when you have the baby, and trying to kind of get into that. I think in general that smoking is one of the worst things a woman can do for her health, and it is a habit that we all need to try to stop, and especially prior to pregnancy. So we are here to help with different medications and support groups to try to, to cut back on that. Smoking can cause growth restriction. It can also decrease your chance of getting pregnant, and then it can also, cause complications, with placental abruption and other things. So, but the biggest thing is the growth restriction. I think in pregnancy and when trying to conceive, just limiting caffeine to 2 cups a day is just fine. I think it is hard to get through the day as a pregnant woman with the hormones of pregnancy and being exhausted, having no caffeine. But I prefer that the caffeine be in the form of coffee and not in the form of diet soda or soda. Alcohol, obviously we cannot drink any alcohol when we're pregnant. There's no safe amount of alcohol that we've seen in pregnancy. But while you're trying to get pregnant, you don't have to be completely alcohol-free. You're going to know that you're pregnant when you're 4 weeks pregnant, when you miss your period, and then you can stop drinking then, because there isn't any blood sharing with the baby until you are 8 weeks pregnant. So I don't recommend that you're binge drinking, but if you're having a glass of wine with dinner here and there, I think that's totally fine as you're trying to get pregnant. I think also when you're trying to prepare for pregnancy is just looking at, are you up to date in your immunizations? Have you been screened, if you wanted to be screened for cystic fibrosis, any other genetic abnormalities? If there's something really interesting or rare in your family, I think we could consider having you set up with a genetic counselor to get more involved in that. Having your flu shot, having your tetanus shot booster, and also we could screen to make sure that you are immune to both chickenpox and rubella, and that's an easy test that we can do in the office. Also considering if you are at risk, STD testing.